Hi, Dr. Ward.
Hi, Miss Smith. How are you today?
I'm having some
see.
problems.
Having some problems. So, tell me about your problems. What brings you in today?
I'm having a lot of constipation and some lower back pain, and I kind of need something for that.
Oh, you're having constipation and lower back pain.
Yeah.
Okay, so I noticed that you were on Percocet, because you were taking that for your lower back pain before.
And my MS, yeah.
And your MS, right. So are you still on the Percocet? Because when I looked through your file, I noticed that I haven't gave you none in over 6 months.
Well, it was kind of an emergency, so I got a prescription from Dr. Rosenbluth and one from Dr. Bowen.
So is Dr. Rosenbluth or Dr. Bauer, I'm not familiar with the names. Where did you get those from?
Well, I mean, they're friends that I've known them for a really long time. They know me really well, and they knew that I was on Percocets, and I ran out, and I couldn't get in to see you soon enough. I was kind of an emergency, so they just wrote me a prescription.
Oh, I don't think that's a good idea for you to just be getting prescriptions from your friends who are physicians. The next time you need something, could you please come into the office so we can give you an evaluation and we'll see what type of prescription you might need.
Okay. I mean, it sounds a lot worse than it actually is. I mean, it was just helping me out.
Oh, okay. All right. Just give us a call and we can evaluate you. And if you need more pain meds, then I'll make the decision and give you more if you need more.
Okay.
So what else been going on with you? I noticed in your blood work that you have a high level of THC.
Oh.
So could you tell me what's going on with that?
Well, I actually saw on TV, Montel Williams has MS, and he uses medical marijuana to cope with that. So I figured if it works for him, it will work for me.
So THC is not considered a medical marijuana.
Yeah, I know it's for the CBD, but that contains it, so it'll work.
So, would it be okay if I ask you a few screening questions, a questionnaire?
Sure. Yeah. Is this confidential?
Oh yes, it's confidential. You don't have to worry about it. Yeah.
Okay.
It's confidential. So, in the past year, I remember you had a history of alcohol. Are you still using alcohol?
No, I haven't had alcohol in a few years. Actually.
Okay. All right. Well, that's good.
It kind of doesn't mix well with the...
Oh, that's good. Alcohol.
Yeah, I'm a nurse. I should know you don't drink alcohol on Percocet.
Okay. What about tobacco products?
I don't really smoke much. It's. No, I'm a nurse. I know you don't really do that.
So therefore, have you been using any illegal drugs lately?
no.
Besides the marijuana?
No, well, marijuana is legalizing. It doesn't count as an illegal drug, right?
Well, no, medical marijuana is a legal drug, but not the street use that you're getting. So that's considered illegal.
Ooh.
So what about any cocaine? You been using any cocaine or anything like that?
I've never used cocaine.
Okay. What about any prescription stimulants?
No, I've never used prescription stimulants.
What about speed or crack or meth?
No.
Okay, well that's good. What about do you inhale any type of glue or gases or paint thin or anything like that?
No, I'm a nurse. I'm way too smart.
Okay. All right. Have you took any LSD or ate mushrooms or PCP or anything like that?
No.
Okay.
Stay away from hallucinogens if I can.
Okay. So, any street opiates as far as heroin or
heroin?
Yeah.
Oh no. I mean, everything is totally legit. I've got prescriptions. I can prove it.
Oh, okay. So the only prescriptions you've been taking is the ones that your friends as physicians gave you, and that's the Percocet that you've been getting a script from your friends.
Yeah.
Oh, okay. I'm gonna have to really look into that.
Oh,
Yeah.
they're not gonna get in trouble, are they?
No, they're not gonna get in trouble. But later it would be a good idea if you can give me their information so I can contact them. Would that be okay?
Okay.
And I know it said it was confidential, but that's fine. So in the last 3 months, how often have you used Percocet or marijuana?
Well, I use both daily, for the pain every day. So I use the medicines every day.
So you would say um, you use it daily, so almost over 6 times a day?
Not 6 times a day, but I use it. I use it daily.
Oh, okay. In the past 3 months, have you had a strong desire or urge to use
Well, when I'm working, I want to, but I can't. I can't interfere with I'm a nurse, so I have to be careful about that. But I do really want to use, like the pain meds and stuff. I can't even use the Percocets while I'm working because it would interfere.
So what you're telling me, you don't use marijuana or the Percocet during your work hours? Is that what you're saying?
No, I don't use them during my work hours.
So in the past 3 months, how often has this been interfering with your health or your social, legal, and financial problems? Have you ever had problems using marijuana all day and Percocet? Is it interfering with your daily activities?
Financially, I can afford it. It's really not that big of a problem. I've never gotten any trouble. The board hasn't had any problems with me. I think my health problems require that I use something. Although, my daughter kind of disagrees. She fights with me every day about my use of stuff. She moved out and she lives with my mom now.
Oh, so your daughter moved out. How old is your daughter?
She's 16.
Oh,
you know how they are at that age.
So she lives with your mom now because she don't agree about your use of marijuana and
I'm sure she'll get
Percocets.
over it. Yeah, I'm sure she'll. She's just a teenager. They all hate their parents at that age, right?
No, not really. They don't. So, in the past 3 months, things that was normally expected that you would do, has that interfered, using the Percocet and marijuana? Has that interfered with your daily activity?
No, of course not. No, I would never allow that.
So you told me that your daughter don't like the idea that you use drugs. Have anybody else said anything to you about the Percocet and marijuana?
Notice
my
that
mom, you're doing different things?
But, it's just because my daughter keeps talking to her about it, nobody else really knows that I'm using the marijuana, but, they yell at me all the time about it.
Have you ever tried to cut down on your uses of the Percocet or the marijuana?
No.
No, not at all?
No, I don't see any reason to.
Have you ever used any injection drugs?
No.
Don't do anything like that?
No. I think that that since I have pain, I probably should use more Percocets and more marijuana, don't you think?
No.
No?
So the screening that we just done actually tell me that you marking is you are high risk. And
for what?
You're on high risk as far as using marijuana and using Percocet. So therefore, what I need to do is I'm gonna have to refer you to actually first I'm gonna have to refer you to I'm gonna refer you out.
for an assessment,
yes,
like a addiction assessment.
Yes,
I'm not addicted.
For treatment.
For treatment. I'm not addicted.
Well, what we can do is I can refer you to a treatment center and why don't you try it for a while, and then you can meet back up with me after your treatment and we can see what goes on. However, I'm also going to refer you to a dietitian for your constipation because I think you need a more healthy diet so you can be regulated. And also I'm going to write a referral for pain management for your lower back. So therefore you could be under supervision for your pain pills and your Percocet, and they'll know as far as what they can give you for your back pain.
Do I have to go to treatment to get the pain management stuff?
No, you don't have to go to treatment to get the
Okay.
pain management stuff. But however, you need to go to treatment also. You need to go for treatment for your Percocet addiction and your marijuana addiction.
I don't know about
So,
an addiction. I mean, I'm not addicted. Yeah.
yeah, I want you to just try it. It might be a
Let
good
me try
idea.
it.
Yes, please try
Are
it.
you sure?
Yeah, sure. And that teach you some healthy coping skills, and you know,
I
let you
don't know.
know
I might
how
have
to.
to cope with all those old people whining at me all day.
Well, no, it's not a lot of old people there.
In the nursing home?
Oh, you talk about at work. Oh, I
Yeah,
thought you were
yeah. I mean, if
referring
I
to the
need coping
treatment
skills
center.
for anything, it's gonna be the old people, right?
Right, right. I thought you was talking about far as your addiction.
I
But
don't know about an addiction, but if you think that I should try it,
yeah,
I'll
when you
just
why
don't
don't
tell
you
the
try
nursing
it?
board about the pop thing.
No, remember I told you it's confidential, so I won't tell the board. But I need to see your progress as far as treatment. So
Okay.
you need to let me know and follow up with me.
Do you want to set an appointment?
Well, what I can do after I do all your referrals, and then you go to your first session for his treatment, and then we can set up a appointment, and maybe you
Okay.
can come back to me and maybe about 2 to 3 weeks.
Okay. Yeah, I can do
Because
that.
then I give you a time to go to pain management,
Mhm.
to see the dietitian,
Okay.
and also have your first session for his treatment. What do you think about that?
I can try it, I guess.
I think that'd be
I
good.
have to.
I think that'd be a good idea.
All right.
All right. Okay, Miss Smith. Thank you for
Thank
coming
you.
in today, and hope your back pain gets better. And follow up with me, okay?
All right.
All righty then. Bye bye.
Bye.